Recording in progress.
All right, Dr. Well, are you ready? All right, Dr. Wells, are you ready? Hi, Dr. Wells.
Yes, I
Okay,
am
are you
here.
ready? I'm gonna have Donna comes up, do the intro for you, okay?
Okay, great.
And then we go from there.
Hello and welcome to today's webinar with eLotus. We have been hosting educational courses here at eLotus for over 2 decades, and we are proud to be your trusted source for premium CEU content with over 250 speakers, 900 courses, and 3,500 hours of continuing education. My name is Donna Chow, and I will be your host and your moderator for today's class. Today's webinar is 20 practical, expert-approved formula strategies for all herbalists with Dr. David Wells. Class will run from 9 a.m. to 6 p.m. Pacific time. We are scheduled to have 4 breaks throughout the day, and Dr. Wells will let you know when that is. And lunch is scheduled from 1 to 2 p.m. Pacific time. So for today's class is very unique because we have 3 groups joining us today. The first one is our Watch It Free group. You guys use the code to get access to this webinar for free. You'll be able to audit the class and you'll be able to audit the live class for educational purposes. The video replay and CEUs are not available to you, but you can upgrade to our second group. Our second group is our paid group. Paid attendees will be able to enjoy today's webinar and watch it as many times as they would like for the next month, as well as earn CEUs, as long as you are here during the live webinar. And finally, if you want to upgrade to our third group, which is our full access, it's our Gold Pass group. You can join our third group, and I'll give you guys more information about it later today. But our Gold Pass members do get access to all the live webinars and as well as all the distant learning courses too as part of their membership. Before we begin, here are some quick logistics about the webinar chat room, questions for our speaker, and your CEU quiz for our paid and Gold Pass members, that is. For the chat room, please set your chat preference to everyone. That way everyone can be part of the conversation. By default, Zoom has it where it is just set to the host and the staff. But so if you don't change it manually, then when you make a comment or you have a question, then only the staff can see it and people get a little bit lost. So let's help everyone out and do this right now and set your chat preference to everyone. Secondly, if you have a question for Dr. Wells specifically, please type them directly into the Q&A box. That way we can keep the questions separate from the chat room. And I know I just mentioned that if questions in the chat room, I just meant questions that are not for Dr. Wells. All right, and then finally the quiz, the CEU quiz, that will be available tomorrow afternoon, and I will send an email out when that is ready. All right, so first off, thank you guys so much for being here. When you've been in this industry long enough, you'll start to notice that Chinese medicine in America is very acupuncture focused. So what happened to the herbs? Did you know that they're just as powerful and sometimes even more powerful than acupuncture? If you're not using herbs or not quite confident enough to prescribe them, then this course was made specifically for you. This course is designed to help practitioners become more familiar with Chinese herbal medicine. It is based on the premise that practitioners have limited budget, shelf space, and working memory. So here are the herbal formulas and practical applications used by Dr. David Wells, who is a seasoned and experienced acupuncturist and herbalist with decades of experience. So you guys are in great hands today. The following categories for Chinese herbal medicine will be covered, and it includes pain, tonics, respiratory, gastrointestinal, genitourinary, gynecological, and vascular. Are you guys ready? Let's do this. Dr. Wells, please go ahead and take over.
Thank you, Donna. I am delighted to see you. So just so that I have a little help from Sam here, I want to know, I'm going to launch my PowerPoint and see if I'm inside the system.
Okay, Dr. Well, are you
Yeah.
first? Are you able to see the share screen button on the Zoom?
Okay, let me go. See, let's get on. Hang on a second. Nope. That's not where I need to be. Okay, there's where I need to be. Okay. Share screen.
Yep.
Okay, I thought we had that working already. Okay. And now
Then we do the slideshow?
I can do the slideshow.
Oh, I
Looks
think you're
like-
already in the slideshow already. Jenny, to
There we
fill up
go.
the screen.
Okay, great. Is
You
this
want to
working?
maximize that screen, Dr. Wells? That way
Ex-
it's nicer
excuse me?
looking.
Excuse me?
You want to maximize that screen. So, the little left corner, top left corner, you have the little red. Yeah, make it. Yeah, the green one, I think. Get you
Okay.
the full screen, I think. Yeah,
Is that
that's
it?
perfect. That looking
Okay.
good.
All right. So will I be able to see the comments from the participants?
Yeah, gonna be on the top of the screen, Dr. Well, when someone typed in or the, on the
Okay.
chat or the Q&A, you should be able to see a notification comes up.
Well, I would like to know who all is watching today because I have some questions for you all. So can I get a list of who's watching, Sam?
Yeah. So are you ever seen at the top of the screen, the little chat options?
When
When you move your mouse
s-
over, you should be able to see that little chat comes up, little options that comes up for you.
Okay, I see my face, and then I see below that Lotus Institute, and then presenter.
No, you have to go a little bit
and,
more up, Dr. Well, where you see what's it called? The Zoom panel comes up.
Okay, we're talking the upper right-hand side?
Oh, no, the straight middle of your screen. The totally straight middle of the screen.
Okay.
On the top, you should be able to see that you are viewing, things like sharing like options.
I see oh yeah, you are screen sharing. Yeah.
Yeah. And then you move a little bit more, and then you should have wait a little bit. The little button will comes up.
A little button comes up.
It comes up for you?
Let's see. Well, I am okay, I moved it to the bottom. That didn't do anything. All right. I don't want to waste any time here, so maybe I'll just proceed with the conversation. Okay, so this seminar came about because I was talking to Tina Chen about what would be helpful for practitioners. And I suggested doing something on herbs. And I said, though, I want to be clear, I'm not an expert on herbs. I'm not like your brother, John Chen. I haven't written books about herbs. I'm just a practitioner. But I have had a lot of experience. And so the questions I want to address is what's practical. And so we only have so much money, we have so much shelf space, we have so many brain cells. We can't really have a huge herbal formula. Like when I went to school, we had to memorize at least 300 individual herbs and 150 formulas for the state board. We had a herbal pharmacy of crude herbs, and we would mix everything up ourselves, and it was huge. We had everything we needed. But in private practice, you have to buy all of those ingredients, and you have to have a place to keep them. You have to maintain the stock, make sure things don't go bad. And then you have to remember what you have so it doesn't go bad sitting on the shelf, and how to use it when you're in a pinch. So my conclusion is you really have to streamline and simplify and just get down to the few things that are most important to you. And I tried to look at, what do herbs do that I can't do with my hands? What do herbs do that the patient can't go to the health food store or their doctor and buy? What is the unique role that herbs fill? Keeping in mind that I am not primarily an herbalist. I'm not trying to solve every problem with herbs. Herbs are just one tool in my box. So we have to look at what are the unique benefits of Chinese herbs. As my teacher, Matt Van Benschoten, once said, that when our ancestors were running around painting their faces blue, the Chinese had already for 1,000 years been finding herbs so that they could remain vital and sexually active into old age. And the herbs my ancestors were taking had to do with driving out evil spirits, and they were laxatives and things that made you vomit and stuff like that. So Chinese medicine is a really deep and wonderful tool, and it addresses a lot of wellness benefits that you don't find in any other form of medicine, or at least not with those particular properties. Another question that's important to ask about herbs are, which formulas are time sensitive? That is, if a patient comes in to see you and they are sick right now, and you can pull something off the shelf and hand it to them to help them deal with their acute symptoms, you've done them a huge service. I know Amazon is fast. A health food store might be down the street. A doctor's appointment might be a day away. But right now is a wonderful benefit. So for many formulas, the reason to have it in the office is because it deals with an acute problem, and it can deal with it right now. Gosh, I wish I could see comments, because I'd love to know what formulas you carry and why you carry them. So as I said, I'm not an expert. I was originally trained by Sifu Sher Lu at the Taoist Sanctuary in the early 1970s. That's in the Los Angeles area. And also by Matt Van Benschoten. Now, Sifu Lu was a very traditional Chinese martial arts and internal system teacher. He was not a teacher of medicine, though he did teach us to make bruise juice, as we called it, or powders to put on lacerations. He also taught some about Chinese herbal medicine, but mostly he talked very little. His English wasn't good, and I remember I was there for 6 months doing martial arts forms. I can't really demonstrate in this limited space, but I was doing a pose where my hand was turned like that, and he ran across the courtyard and said, no, 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 and moved my hand this much. and I felt a rush of energy go down through my body and out my heel on the back foot. I'm like, oh, form is very important. And then he just walk away, not speak to me again for weeks. So he was that kind of teacher. Anyway, I'm deeply indebted to him because without him, I would never have come to know and appreciate and love what's turned out to be my profession. I also trained with Matt Van Benschoten in the early 1980s. He was my herb teacher. Here's a picture of Cher Lu. Funny to look at it now because he was probably 40 and I'm 70. And he was the old man. Sifu basically means old man. That he was a wonderful teacher in that he taught the Taoist internal system, not just Qigong, but also Nui Gong and Baliao Qigong, external healing with energy to all of us round eyes, which was quite a privilege. These were things that really had never been taught before outside of the Chinese community and monasteries. So we were quite privileged to study with him. My dear friend, Matt Van Benschoten, who passed away a few years ago, I had, I think, 6 semesters of herbs with him. And he was really an herbal genius. And I cannot teach at the level he did, but I just want to honor him and give you an example. I remember someone asked him a question, and he got that sort of far off look in his eye, which he often did. And he turned around to the blackboard and he started writing Chinese characters as fast as he could, filled up the whole blackboard. And he stood back and looked at it. And then he turned around and started talking about chemical components, research in China and Vietnam and France and Japan and manufacturing processes. And he just was encyclopedic in his knowledge of Chinese herbal medicine. And I owe everything I've learned to him. So when I was training with Sifu Lu, acupuncture was not yet licensed in the state of California. And I remember writing letters to help bring Master Ni over, whose sons have then gone on to form Emperor's College. I remember Jacques Miamorco, I believe his name, came and did the first acupuncture on me, which was ear acupuncture. Acupuncture was not something readily available in this country. Bought any book we could get on the subject. Felix Mann was an early publisher. The Essentials of Chinese Medicine didn't come out till much later. So when I was training in essentially Chinese energetic medicine, that is how to perceive energy visually and with my hands, and then move energy with my hands and my mind in patients and treating people that way, there was no licensure for acupuncture. And there was someone else training at the Taoist sanctuary who was a chiropractor. And I remember one day we were practicing sparring and I kicked my partner, and my partner had then wrist pain and numbness and tingling down into the 2 little fingers here, which would be, I know now, an ulnar radiculopathy. But anyway, he'd sprained his wrist blocking my kick. He turned to the guy next to him who was sparring, Bill Emmert, a chiropractor, and he said, "Bill, what can you do for my wrist?" And Bill took it and did a little move here and hold something, and then he could move his wrist again. And my sparring partner said, yeah, but it's still numb and tingly along these little fingers here. And so Bill just sort of waved his hands a few times and the numbness and tingling went away. And I was completely floored. Never seen anything like it in my life. I knew that it should take 2 weeks at least for a sprain. I've had plenty of sprained ankles and whatnot. And so I just couldn't understand it. And I said to him, what did you just do? What was that? And he says, oh, well, the first part, that was chiropractic. What's that? Well, that's how you treat people by manipulating joints instead of using drugs or surgery. And what about waving your hand in the air? And he said, well, you learn that here. You just got to come a different, come on Tuesday nights for that. And that's a healing practice using energy, using the chi. And to do that, you have to be really strong in your practice of Nui Gong. So anyway, I got fully involved in all of that. I became ordained as a Taoist priest, which was the first batch of Taoist priests in the United States. The guy in charge, Kai Di, applied to the government to get that approval. So Taoism could be recognized as a religion in the United States. Anyway, all of that is background. I then got pretty excited about treating people, and I was treating everybody I could, everywhere, family, friends, strangers. I eventually was being flown around the state to treat people. Went to Esalen Institute and demonstrated there. Anyway, did a lot of energy work. And one day, Bill Emmerd said to me, why don't you get a license so you can make a living treating people? And I didn't know anything about that. And he said, well, become a chiropractor like me. And I was like, okay. What does it require? He says, well, it takes 4 years of college. And I said, I've been in college 4 years already. I really want to get out and get doing something. He says, in 4 years, you're going to be 4 years older anyway. Why don't you be doing something you love? So I'm just like, okay. So I basically went and signed up. I didn't know really a thing about chiropractic, but I became a chiropractor literally in order to practice energy based on Qigong. As I went through chiropractic college, and they would say, ringing in the ears, 8th cranial nerve. And I'd say like, yeah, well, what about kidney deficiency? All the way through, I was screening Western medicine through the viewpoint of Chinese medicine. After I was in practice a few years, acupuncture became licensed. A school opened up near me. And then I enrolled in acupuncture college. And as I went through, and they would say things like yang deficiency, the patient is cold and fatigued. And I'm thinking, what about hypothyroidism? So I ended up screening Chinese medicine through my prior training in Western medicine. So anyway, I got a thorough mix and match and integration of those 2 ways of thinking about the body, 2 sets of maps for the body. And so I'm basically a hands-on treater. I do things with my hands, a lot of acupuncture, use an activator for chiropractic or finger pressure. I don't twist and pop to manipulate joints. And so for me, herbs are adjunctive. They aren't the primary part of my practice, but herbs fill a very important role. And so I think this may be true for a lot of you who primarily rely on your hands to do your work. I've been in practice as a licensee for over 40 years and treating between 100 and 150 patients a week, probably averaging around 120 a week. So I had a lot of practice treating people. a lot of successes, a lot of learning experiences, and a lot of persistence, just trying to learn more and more and do a better job as they went along. So I hope that that practice, that experience can be a benefit to you today. So here's where I want to know, who do you attract to your practice? And maybe Donna, if you could speak into my ear since I can't see comments. What I'm talking about is if you do, for instance, fertility treatment, or if you do primarily upper respiratory or GI patients, or you do more esoteric, energetic work, what's the population of people that you bring into your practice? Anyone? So Donna, could you say something so I know that that works?
Yep.
Okay, there you are.
I got it. We got any stuff coming up. Stress, emotional pain, fertility, chronic pain, autoimmune, mental health issues, emotional, mainly pain, post chemo, allergy, headache, oncology support.
Hmm.
Pain focus, immunity, or someone say all issues, weight loss.
You know, there's a classic response to, do you do acupuncture for weight loss? And you purse your lips and thread a needle between the two of them. But I imagine this respondent knows a lot of other ways to help people with that, other than I never really did weight loss with acupuncture, because it seemed to me you have to keep doing it. So I'm intrigued to know how you could be successful, as opposed to quit smoking or something, which is generally as up to a week of treatment and then you're done. But that's interesting. I'm also very impressed at the range and diversity, though, of, like, to specialize in cancer support or mental health. That's just, it's fantastic, the variety of kinds of practice that now exist that really didn't exist at one time. So yeah, we just covering that. So then how do the herbs fit in your practice? Are they adjunctive? Maybe people could just write yes. Or are they primary? Is your practice primarily an herb-based practice? Or are you not using herbs? If you could just answer one of those three and give me a sense of what the group's doing.
We got yes, and then we got a chance. By the way, you not able to see any notification on the chat on the top of the screen? Anything like that?
Notification, I
Yeah,
have.
usually it pops up for you. I'm not
Yeah,
sure.
I don't have anything. I have, well, let's look under more.
Hmm.
Okay, so I have left to right, mute, stop video, participants, chat. Oh, if I
Yeah.
click on chat.
Yeah,
Oh,
yeah, you see that. Cool.
fantastic.
Yeah, that would be where you're able to, pop
Oh,
up,
hi,
click, and then
Jeannie
yeah,
Townsend. I haven't
cool.
talked to you in years. Oh, that's fantastic. Oh, this is great. Thanks, Sam. That really helps.
Yeah, so you could open up, close it out after you're done reading or you're done viewing
No,
the
I like
chat.
I
You can
like
close it out.
to know what people are thinking. That's fantastic. Okay, looks like almost everybody is from the United States. A lot of them are here in California. That's great. Oh, I'm so glad to have this be two-way. I'm really sorry we can't all be together in the same room. I love just having you touch something and feel it for yourself to know exactly what I'm talking about, or we can both look at a tongue or a pulse or any physical characteristic together. It's so much nicer. Okay, I see someone does a lot of headache. Okay, public health. Oh, I love that. Just want people to be happier and everything the tide washes in. And okay, someone's also naturopath. Wonderful. Anyone from out of the country? Okay.
Earlier, I saw someone from Israel.
Okay.
I would
Sweden.
say Sweden.
Fantastic. Wow. That's terrific. Okay. And Canada, 2 Canadas. That's fabulous. And Taiwan, Japan, fantastic. Okay, so in prescribing herbs, this is a tricky thing because we are little small fish in an ocean full of whales and sharks. How does prescribing herbs integrate or conflict with the medical community in your area? Do you have problems when you prescribe something and the medical doctor says, I want you to stop that because it might conflict with the drugs and I don't know how it works? Do you have good working relationships with doctors so that they trust you on that? Do you rely on John Chen's book, which shows drug herb interactions? Do they think herbs are like chamomile and it can't possibly have any effect on their powerful, wonderful herbs? So, oh, that's great. It's good to see there's a wide variety, but a lot of wonderful MDs out there. That's fantastic. Things have changed so much. And as a profession, we get a lot of credit for being responsible and trying to make things work well for everybody. That's really great. I hope everyone has a good relationship with medical doctors. In the world of chiropractic, there was a lawsuit, I think it settled in 1973, against 23 organizations, including the American Medical Association, Joint Commission on Hospitals, Osteopathic Association, et cetera, who were all conspiring to eliminate the practice of chiropractic. And they made it so, like, if I had a patient with a heart attack and I sent them to the hospital would not accept them because they'd been treated by a chiropractor. We were like somehow like projectile leprosy, you know, if we touch them, no one will touch them. And it really made it hard. Acupuncture never really had that problem. We were seen as maybe weird, maybe ineffective, but rarely seen as a direct economic threat. And I think the medical model is in some ways more similar. The other thing that I think most MDs don't realize is that the drugs that they prescribe are largely based on Chinese medicines. Remember I talked about my ancestors painting themselves blue? That was eSotus. And that was because if they got cut in battle, most people died not from the cut, but from the infection afterwards. And so that was a protection against dying from battle, you know, but Keflex, most of the antibiotics come from Chinese herbal medicine, and then they were refined and they figure out some way to synthesize it so that they can uniquely patent a molecule that doesn't occur in nature. But honestly, the plant life has had a few billion years to figure out how not to get sick and die. The natural world has been doing a marvelous job fighting against bacteria and doing all these things. And so chemists and drug companies are nowhere near as creative and successful as nature has been. So what they'll often do is take a herbal medicine that works, tweak it in some way by putting a little side chain on it, calling it a unique thing that doesn't occur in nature, patenting it, and then prescribing it. And then that little side chain will, yes, it was woad. I didn't realize it was psychoactive. But the side chain on those medicines will then plug into something, because everything's made out of carbon, nitrogen, oxygen, there's just a few organic molecules. And so they're going to fit into some kind of, it's like a key and a lock, the drug fits into a receptor site and boom, something happens. So you create side effects. So in many ways, our formulas are a lot safer than the refined and more powerful drugs. We'll get into that a little later. So what are the essential formulas? And I list this because, as someone said, I treat everything that the tide washes in. I had a general practice, and I say had because I haven't been actively treating since the pandemic got going. By the way, I'd like to correct the bio, which said I've been working tirelessly for the profession. That was true when that was written. I did an awful lot of things, passed laws, fought for broader scope of practice, helped professionalize us, get us covered by insurance company in 17 states. Probably the most lasting thing I did that's of value to you on a regular basis is I wrote and successfully defended to the Relative Unit Committee of the American Medical Association the treatment codes that we have to use in order to bill and get paid for our services. But anyways, I treated everything that came in, mostly doing musculoskeletal, largely because pain is very satisfying to get rid of, makes people really happy to do that, and they tell their friends, and so I get more of them. But the top 10 conditions treated by acupuncturists in the US are lower back pain, depression, anxiety, headache, arthritis, allergies, general pain, female infertility, insomnia, neck pain, and frozen shoulder. And that comes from the government PubMed statistics. So if you are not treating pain and you have room in your practice, you may be missing out, because you can see a lot of the reasons people seek care are for that. I know there are specialists. I taught for a while at Yosan, and they had a whole track on female infertility. And many of those people did not want to have anything to do with pain. They just wanted to focus on the infertility, and I respect that. You may be a specialist up to your ears in autoimmune problems or post cancer or chemo support, and that's great. But if you're in general practice and you aren't treating pain, you may be missing out, because that's one of the, well, it is the most common reasons people come to get treatment. And it's actually very easy to be effective with pain using acupuncture. So we're going to go through, as Donna said, these categories: pain, and then really anxiety, depression is a huge category, and one which is not satisfactorily treated by other Western medicine in particular. Tonics is really unique. That's one of the things I thought, I have to keep tonics in my office because nothing else does that. You can't take a vitamin, you can't eat a food. There's nothing else that does tonics the way Chinese medicine does. Then there's respiratory problems, gastrointestinal, genitourinary, gynecologic, and vascular. So let's start with pain. The formulas I want to cover are back support HD, which HD is code for herniated disc. And you have to put things in code because the FDA and the Federal Trade Commission will not allow anyone to make claims for products on a label. So we have to be very careful about that. And so Evergreen Herbs has chosen to call it Back Support HD. Herbal ANG, the ANG stands for analgesic. Evodia combination, of course, is named after the chief herb. Dermatrol HZ, and there are several Dermatrol products. I've used two of them. This one I use more than any other. It stands for herpes zoster. And then under that is neck and shoulder AC, which means acute, and neck and shoulder CR, which stands for chronic. So let's talk about lower back. The CDC says that low back pain causes, quote, more disability around the world than any other condition. So there's a huge amount of suffering everywhere. And many of your patients who are coming to see you for something else, maybe their anxiety, maybe their respiratory problem, their asthma, they ask around. Many of them also have lower back pain because it's extremely common. In the third world, it's common usually because of lifting injuries and strain. In this country, it's mostly common because of sitting too much, which is its own unique kind of condition, and we will address that in a little bit. How about this? In the past 3 months, 25% of US adults report lower back pain. So again, if there's 4 people in your waiting room, one of them either has or recently had lower back pain. And I say this as a practitioner, you're always marketing. You always want to reach as many people as you can. And I know marketing is kind of a nasty word to a lot of people, but think of it this way. There's a lot of suffering in the world. If they don't know that you can help them, then they're going to continue to suffer. So you have to communicate and let people know what you treat. I've had people who I have treated, let's say, for a whiplash injury, and they say, you know, my husband has back pain. Do you treat back pain? I was like, yeah, you know, or I might be treating them for asthma or something else. And they're surprised that I treat pain. It's just because you know you can treat everything under the sun doesn't mean your patients know. You have to let them know. So why use herbs? And that's a legitimate question. How many people use herbs when treating lumbar disc injury? Well, I guess, and if you don't treat it, just say, I don't treat it. Okay, always for back pain. Yes, yes, yes. No. I like that. I love treating pain. Me too. Herbs as much as possible. So for me, I don't use herbs routinely for back pain, but I do use it quite a bit. And there's a couple reasons for that. But first of all, the reason I use herbs for lower back pain, particularly acute lumbar disc pain, is that the things that I can do in the office or teach them to do at home do not provide total relief. And I want to address that one of the most important things about treating people. Oh, and yes, I see someone saying the rest are scared of their doctor's disapproval, and that's a reason not to. But acupuncture is extremely effective for lower back pain, for lumbar disc pain. I think I'll talk about that a little more in a bit. And the McKenzie exercises, we'll go into that a little later also. So generally, I get people mostly out of pain and standing up straight on the first visit. But you know, they still will have some pain. You're going to have an inflammatory process that will hurt for a few weeks. The biggest thing to remember when treating people is that they not only have their presenting complaint, they have their fear about the presenting complaint. I bent over to pick up the dog dish and now I can't straighten up. I'm going to walk around bent over the rest of my life. Everyone will laugh at me. I can't go to work anymore. And, you know, it's like people have a whole lot in their head about the condition that they're asking for help that they don't tell you. And so I think it's best to assume that they had to be terrified that their life as they knew it is over in order for them to come into the office and see you. Address the fear. One of the things that helps address fear is things the patient could do at home. The McKenzie exercises are a great example, and taking the herbs is a great example, because what we need when we feel out of control and overwhelmed and afraid is we need to have something we can do personally that leads us toward our goal. So herbs help to fulfill that. And the medical alternative, which, believe me, I have called their doctor and arranged for on many occasions, is a Medrol dose pack. How many people know about Medrol? It's methylprednisone. Have you had patients who've taken it or you have taken it? Yeah, more yeses than no. And people know it's it's a steroid. Yeah, well, let me tell you a little about Medrol. It's methylprednisone, which is a steroid. And so steroids shrink inflammation. And initially, with a sprain injury or a lumbar disc rupture, in order for the disc to move toward the nerve root, you have to tear the ligament, so you have a sprain. And sometimes that's all you have, and sometimes you also have the disc pushing on the nerve also. But anyway, the sprain component of it creates a huge halo of swelling around the damaged tissue. And that swelling puts pressure, crushing the nerve as it goes through the little hole to come out to your legs or down your arms or wherever it's coming from. So the Medrol shrinks that swelling, taking the pressure off the nerve. This can be really important if a nerve is crushed too much, you could kill the nerve. For instance, they give steroids in head injuries where there's swelling inside the brain. If you crush too much of the brain, it doesn't work very well. So steroids can be a really important thing to preserve function for later. But steroids, of course, have huge downsides. And the way they, and yes, no, we can't order it. It's a scheduled drug with the FDA. But orthopedists routinely do. And so if you have a good working relationship with an orthopedist, you can call them, or if you know the patient's doctor, you can call the doctor and say, your patient has this presentation, appears to be this condition. I would like them to be on Medrol for 5 days. Do you want to see them, or you just want to call it in? And if they trust your diagnostic skills, maybe they'll just call it in for the patient. But anyway, that can shrink the swelling and give a lot of relief in the short term. And there are times when it's the best approach. Now, the way it works is it comes where you take like 5 the first day, then 4 the next day, and then 3, and then 2, then 1, and then none. And the reason it doses that way is you take this huge dose in order to bring the swelling down right away, but that shuts down your own adrenal production of steroid hormones. So you want to coax that to come back online by tapering the dose as soon as you possibly can. This is not a long-term drug, at least for acute sprain, strain, disc rupture type of problems. So anyway, Medrol is useful in some specific cases, but it can also give you a lot of other problems. Somebody's got an actual question. Pain of 9 due to sciatica, taking 5 grams of Tylenol for weeks against doctor's advice. Would I rather have them take Medrol in this situation? Yeah, Tylenol will eventually wreck your liver. So, and then yes, you can use microcurrent. There's a lot of things you can do to bring it down. But you may have to have a short course of steroids in order to get them out of the worst of the problem. So it is, though, not without risk. Steroids have a huge list of contraindications, and some of them are summed up by what's called Cushing's syndrome, which you should know on its own terms because it's a metabolic condition that can be addressed with Chinese medicine. And this is Cushing's is caused by elevated adrenocorticotropic hormone, usually from a pituitary tumor, and it causes weight gain, water retention, moon face, meaning a round face, a buffalo hump, which means that when you touch the T1 Dahui, I believe they call it, the big bone at the top of the shoulder, you can't actually touch it because it's got a squishy fat pad over it. Water retention, elevated blood pressure, glaucoma and cataracts, osteoporosis. One of the physical signs you can check for on this, besides, and believe me, this is worth, once you see this, once you know what to look for, you will recognize it. The round face, the buffalo hump. The other things you can start looking for are red or purple stretch marks. And I don't mean right after giving birth. I mean, years later. Darkening of creases, like on the palms or the wrist or the antecubital fossa and the elbow. And then excess facial or body hair for women, muscle atrophy, kidney stones, erectile dysfunction, poor concentration and memory, and it goes on. Anyway, yes, JFK was believed to have had Cushing's. No, Addison's. Addison's, you're right. The philanderer in chief. Anyway, that is if you see those signs like the round face, you touch up here, the spinous process of T1, and you feel it's squishy with fat. You feel above the collarbones. You can't see the collarbones because it's filled in with fat right in there. Then start checking for creases, dark creases, stress marks, and so on. Anyway, that can be a clue that you can really help somebody in a whole nother way that they're not getting help with, or at least be on the lookout for problems that they might develop. Now, there are people who have to take steroids long term. We'll get to that when we get to the lung section. And so everything we can do to reduce dependency on steroids is really a good thing, because you can see all the problems it leads to. There are what they call NSAIDs, or non-steroidal anti-inflammatory drugs, such as aspirin, Aleve, Advil, Motrin, Voltaren, and they work by blocking pro-inflammatory prostaglandins. Our bodies make prostaglandins, which either make more inflammation or depressed inflammation. And that's because the immune system uses inflammation to fight infection, to repair tissue, to do a lot of good things, but too much of it's not a good thing. So there has to be this balance. In fact, just for a moment, I want to go through the process of inflammation. I know you're familiar with it, but it's worth going over. If let's say you have a joint here and you tear the ligament holding the joint together, or you get stabbed and there's a cut and you're bleeding out. Well, one of the first things that happens is the cells that are suddenly where they're not supposed to be. Let's take the example of the cut. They begin to react to the air and start to form a barrier so you don't keep leaking forever. And then you produce inflammation locally, and the inflammation causes swelling, which limits the amount of blood that can get into the area and be lost. Swelling, like in a joint, limits, say, the amount of motion in the joint, so you won't continue to aggravate it or hurt it. It forms a kind of a cast around the injured area. So swelling is actually good for us. It's something the body does to try to help a problem. And the same thing with, say, if you have an infection, you get a fever, which is an inflammatory process, to make life so miserable for the bacteria that your immune system can pick them off in their weakened state. So we want inflammation, and we want to suppress inflammation. We want that process to be in balance. We want it to be controlled by our body, by our immune system, not forced by a pill we take or a drug prescribed or injected in us, as much as possible. There are times where a pill or an injection or something can be a lifesaver, or it can be extremely helpful. But long-term dependence on these medications, not a great idea. So where do we get prostaglandins? The pro-inflammatory prostaglandins are made from omega-6 fats in the diet. The anti-inflammatory prostaglandins are made from omega-3 fats in the diet. Traditionally, diets around the world, from Hottentots to Eskimos, the diets were a ratio of 1-to-1 omega-3 to omega-6, or 1 part omega-3 to 3 parts omega-6. That was the normal ratio when you're eating plants and animals and things you can gather with your hands or hunt. Modern diets, by contrast, are 1 to 20 omega-3 to omega-6. And so how does that happen? Well, primarily corn is at the base of our food chain. So is that you, Sam, making some noises?
No.
Grains have a high omega-6 count. And government policy since the Nixon administration in this country has been to promote farmers growing corn, feeding corn to animals, making sugar out of corn, making oil out of corn. And so we've changed the way people eat, and it's cheaper in part because of government subsidies. And the whole idea was during Nixon's term, they lost midterm elections because the price of groceries went up. And Nixon told Earl Butz, the Secretary of Agriculture, make sure that never happens again. They changed the way subsidies worked, which were put in place in the Depression to promote lots of cheap food. And so we have cheap food and expensive healthcare as a result of that. So anyway, the base of our food chain and our diet is primarily corn. You think you're not eating corn? Well, the animals you eat were fed on corn. There's over 120,000 products in a supermarket that are made from corn. So even the linoleum's made from corn. It's in the toothpaste. It's pretty much universal. And I'm not saying corn's a bad thing. It's a wonderful food. It just shouldn't be everything. It used to be that when cowboys ran their herd across the plains or fed them in a pasture, they were eating grass and bugs. And the bugs have a whole lot of omega-3s. That's why you see pasture raised as a good thing when you go to the market to buy eggs or something. If it's really true that they're out wandering around eating bugs and plants, they're going to have a very high level of omega-3 fats compared to the way eggs or farm animals or milk are normally produced, where they're fed so much corn and they have a very high level of omega-6 fats. So anyway, it's a thing to be aware of, that our modern diet promotes inflammation. So every disease that ends with the word itis is due to this high omega-6, low omega-3 ratio in our diet. And a huge change can be made for you and your patients by being more mindful about that. By the way, that business on corn comes from a book by Michael Pollan called The Omnivore's Dilemma. And it goes into a lot of detail on that if you're interested. So NSAIDs have side effects. Stomach ulcers and other bleeds like in the small intestine. They are the leading cause of stomach ulcers in this country. Also hypertension and heart attack, particularly Vioxx and Celebrex, because they are COX-2 inhibitors that were based on Chinese herbs, but modified. Going back to what I said earlier about a drug company can't just sell you an herb, because they can be, all the effort they go to bring it to market, they can be outcompeted at the grocery store. So they want to make their product unique, patentable, patent protected for a few years, charge a lot of money for it. Reminds me, I was once in an FDA panel, I was the only acupuncturist there, advocating for Chinese herbal medicine to a panel of regulators at the FDA. And and there are also drug companies there. And one of the drug company representatives said they were spending $500 million to patent some active ingredients in garlic. And that would give them the right to say their garlic, unlike everybody else, could be used to treat these FDA-approved conditions. And they felt that it was worthwhile. Just another kind of funny note from that, there was a speaker, maybe he followed me, I can't remember, but a speaker came up to the microphone from the FDA and said, I don't care how many millions of people have taken a particular herb over how many thousands of years, all of those people died now, didn't they? What is wrong with you people? But anyway, that's how they think about it. And by the way, that was in the Washington, D.C. area. In California, I sponsored meetings with the Food and Drug Branch, which is the local version of the FDA, the California version. And I remember Richard Coe, the head of that organization, saying that intent is what makes things a drug, not what's in it. It's the intent of the practitioner. And so, of course, we're at a conference table, and I picked up the glass of water and I said, so if I give you this glass of water with the intent of treating your thirst, does that make it a drug? And he said, yes, subject to all the years and millions of dollars of testing and post-market surveillance of any other drug. Like, wow. So I said to him, well, if a patient comes to see me, let's say I have a kid who comes to see me and they have childhood asthma, and I give them bupleurum and cinnamon for that. My notes clearly say why they came and what I did to treat them. And they didn't need acupuncture. They were not acute. There was nothing else done. I couldn't say I just handed these herbs to them. Herbs were the treatment. Clearly acupuncturists are using herbs to treat disease. What do we do about that? And there was an out. He said that the state boards regulate practice. The FDA and Food and Drug Branch in California regulate interstate sale and commerce. So once it gets in our hands, we're able to use it without restriction from them. So guess where they got the COX-2 inhibitors? Turmeric and ginger, which, turmeric is yellow ginger in Chinese. They have the same active ingredient, very strong anti-inflammatory. However, people have been eating it by the pound, and this goes back to that guy who said, yeah, but they all died. Well, you go to India or all kinds of places, people are eating a ton of ginger and turmeric every day. They seem to be doing just fine. In fact, there's a lot of research on the benefits. So let's talk about NSAIDs. Do they actually even work? 277 patients with moderate to severe osteoarthritis of the knee who took NSAIDs compared to a similar group without medication found worsening on MRI of the knee 4 years later. So this shows not only were there no protective mechanisms from NSAIDs or slowing down of the progression of osteoarthritis, they actually made it worse. And by the way, information from these slides, if you want to look up the, those who have paid to take the course, of course, can look at the notes later and follow it on their own. Okay, well, we're actually about to start something, and I'm told I should be taking a break in about 5 minutes, so I think this is probably a good spot. You there, Donna? Did everyone, did the Super Bowl start already? Okay, well, I'm glad to hear the rest of you are here. All right.
We here.
There you are. Sam's there. So what I am going to suggest is that we take, it's a 15-minute break. Is that what's, yeah, okay. So
Yeah, we
let's
can take
go
15.
to 10:25. All
Okay.
right. I'll see you after that. Thank you.
Thank you.
Recording stopped.
I love the comments.